So if you have fertility issues or suspect that you might be having fertility issues, you've probably heard of the term IVF, in vitro fertilization. And this is such a common fertility treatment because it is often the most effective. It's also the most invasive, but it helps to bypass a lot of different fertility issues, which is why so many couples, single women, anybody trying to become pregnant and having fertility issues, or say men that are utilizing an egg donor and a surrogate, IVF is what so many people utilize to become pregnant or build their family when getting pregnant through intercourse is not an option. Okay, so there are a lot of different reasons that somebody might need IVF. Some women over the age of 35, some women under the age of 35 too, of course, sometimes need IVF, but it's more common with women 35 and older, because as we age, the quality and quantity of our eggs decrease, and we have a higher chance as we age that those eggs will have chromosomal abnormalities, which can make it more difficult to conceive a healthy pregnancy. And so because of this, it could become really difficult to conceive or to develop a pregnancy that doesn't end in miscarriage. So IVF can be very successful for women over the age of 35 that have been trying to become pregnant for 6 months or more without becoming pregnant. So that's usually the guideline. If you, or the common recommendation by ASRM, that if you're 35 or older, you've been trying to become pregnant for 6 months or more, then it's typically wise to go and see a fertility specialist. They might not find any fertility issues. They might say you're fine to just continue with intercourse, or they might recommend other fertility treatments that are less invasive than IVF, say IUI. Okay, blocked tubes. So a woman that has blocked, damaged fallopian tubes might need IVF because sperm could have difficulty reaching the egg, or that fertilized egg could have an issue getting into the uterus if there's blockages in the fallopian tubes, because the sperm need to travel up the fallopian tubes to get to the egg, and then that fertilized egg needs to go back down through the fallopian tube to get into the uterus. IVF completely bypasses the fallopian tubes, which is why it can be so effective for women that have this issue. Endometriosis. So sometimes women with endometriosis will need to utilize IVF to become pregnant. So endometriosis, it results in the lining of the uterus implanting in other areas of the body, and this could cause scarring, which can cause issues with the ovaries, the fallopian tubes, the uterus. Male factor fertility issues. So if the man has a lot of issues with sperm production, quality, mobility, it could lead to the need for IVF, specifically the need for IVF with something called ICSI, which means that the embryologist injects a single healthy sperm into the center of a mature egg. Recurrent miscarriages. So chromosomal abnormalities are the result of about 50% of miscarriages. So if a woman has been having recurrent miscarriages, the doctor might recommend IVF with something called PGT, which is pre-implantation genetic testing. And this allows the embryologist to test essentially the chromosomal health, the genetic health of embryos that result from fertilization of the eggs in the lab. And then this helps to ensure that the doctor only implants one healthy embryo into the uterus of the woman during an IVF cycle. And IVF is also, a common treatment for couples that have tried a lot of other treatments. Nothing has been successful. And so they go to IVF because, again, it is the most invasive, but also, as I've said, often the most effective. Okay, so what does an IVF cycle entail? So it starts with the woman receiving evaluations, which consists of a blood test and an ultrasound at the fertility clinic. And this helps the fertility doctor assess the health of a woman's uterus to make sure that she can, or she has a good chance of carrying a healthy pregnancy in the uterus, that there's no issues that would impede the embryo's ability to successfully implant in the uterus. And the blood work and the ultrasound allow the doctor to assess the woman's ovarian reserve, which is essentially the quality and quantity of her eggs. And they also assess if the woman has a male partner and he's the one providing the sperm. They also assess his sperm to ensure that it has a good chance of fertilizing the eggs. And if she doesn't have a male partner, or if the male partner has a lot of fertility issues, then she might need to select a sperm donor before starting the IVF cycle. Okay, so following these initial evaluations, if the couple or the woman gets the go-ahead to start the IVF cycle, it begins with her taking ovulation induction medications while being regularly monitored at our clinic. And these evaluations, usually after the woman starts the medications, typically like every other day, she'll go to the fertility clinic for a blood test and an ultrasound. And this allows the doctor to essentially track the growth of the eggs. So the injectable medications the woman takes causes multiple eggs to mature and grow. And when they reach an ideal size, that's when they retrieve them. And then the blood test allows the doctor to assess the woman's hormone levels. And they want to monitor her hormone levels carefully, because if they reach a certain level, it could increase the chance of something called ovarian hyperstimulation syndrome, OHSS. And this is pretty rare, but it can cause the ovaries to swell, fill with fluid, and that can be really uncomfortable. Usually, if this does occur, it's something that occurs after the egg retrieval. It's usually not dangerous, it usually resolves on its own, but again, it's just uncomfortable. So that's one reason why they carefully monitor the woman's hormone levels. And if they're worried about them, getting too high, then they would adjust the woman's medications typically. So after every time she goes in for an evaluation, later that afternoon, they'll contact the woman and let her know, just continue with the medications as is, or adjust to this dosage, or stop taking this medication. So the woman is in regular contact with the fertility clinic during the egg donation cycle. Usually women are on these medications for like maybe 7 to 10 days, sometimes more, sometimes less. It just depends on her response, but usually around a week or so. Okay, so in regards to the medications, so the woman would take what's called FSH, follicle stimulating hormone medications, for 7 to 10, maybe even 13 days. Again, it just depends on how she responds. And these medications, they're the medications that cause the ovarian follicles to grow, the eggs to mature. Common brand names for FSH medications are Follistim and Gonal F. Women also take something called a minotropin medication to stimulate egg production. And this medication is a combination hormonal medication that contains FSH and luteinizing hormone, LH. And Minipure is the most common brand name for this. And then at a certain point, the doctor will instruct the woman to take a GnRH antagonist medication. And this stops the ovaries from ovulating, from releasing the mature eggs. And common brand names for this are Ganirelix and Centrotide. Okay, and so when the doctor determines that the eggs have reached an ideal size, they instruct the woman to take an HCG medication that triggers the final maturation of the eggs. And then about 35 to 36 hours after the woman takes that injection, or injects that medication, the doctor will retrieve the eggs during a simple procedure. Common brand names for what we call the trigger shot are Ovdrel, Novarel, and Pregnol. And sometimes the doctor will prescribe something called Lupron, which is not an HCG medication, but it can still trigger the release of those eggs. So the woman, again, 35 to 36 hours later, goes into the clinic. She has somebody drive her because she will be going under general anesthesia. She's taken to pre-op. They do some blood work. They just assess that she's, all good, ready for the egg retrieval. Then she is put under with general anesthesia. The retrieval itself doesn't take that long, about 15 minutes or so. And then when it's complete, the woman is brought out of her deep sleep, and she'll probably have a little bit of spotting, a little bit of cramping, but is often clear to go home about 45 minutes to an hour after the egg retrieval. And then a lot of times later that day, the clinic will let the woman know how many eggs were retrieved. After that retrieval, the eggs are sent to the fertility lab, where an embryologist fertilizes the eggs with sperm from the woman's partner or her sperm donor. In this situation, again, if something like ICSI was needed, this is when the embryologist would inject one single healthy sperm into the center of one of the mature eggs. And if the woman needs PGT, that pre-implantation genetic testing, after the eggs are fertilized, they'll then take the fertilized eggs, aka the embryos, and test them for, again, genetic chromosomal issues. They'll let the fertility doctor know, how many healthy embryos they are. Usually they can also tell you the sex of those embryos. And then with your fertility doctor, you determine which embryo you want to implant into the uterus. And this is a simple procedure that involves the woman going into the fertility clinic and the fertility doctor injecting that one healthy embryo into her uterus, where ideally it will implant. A lot of times they'll have the woman take progesterone leading up to the embryo transfer to increase the chance that her uterine lining is nice and healthy and can support the implantation of the embryo. So that's a general overview of an IVF cycle. If you have any questions about this or any other fertility treatments or anything else in the realm of fertility, pregnancy, childbirth, please let me know in the comments below.